Hi, I'm Dr. Schuljak, and today I'm making a video to talk to you about what aftercare looks like for your patient, your cat or dog's dental procedure that they had performed. So, first things first, what all is involved in a dental procedure? The first things that we do for them is take full mouth x-rays, making sure there's no disease underneath the gum line for your pet. Next things that we do, scale and polish all the teeth, removing all the plaque, tartar that are caked on their teeth from their previous, however long it has been since their previous dental procedure, or if they've never had one, since they've been alive for us. And then the last thing that we do as doctors is we probe the entire mouth, making sure there's no disease that we can see visible above the gum line, and making sure that they don't need any extra treatments such as extractions, subgingival scaling, anything that would require more intense work than regular routine scaling and polishing for them. Main things that we'll talk about here today otherwise would be if they're able to eat and drink when they go home, what medications your pet may go home with, and then aftercare instructions for extractions that your pet may have had performed. So for food and drink monitoring, most pets are able to go home, eat and drink the night of the procedure. They're allowed to have unlimited access to water as long as they're not showing us any signs of nausea. Similarly with food, they are allowed to have their dinner if they're once again not showing us any signs of nausea, which may include excessive lip licking, drooling, or potentially even vomiting. If any of those occur, I do recommend contacting us and then also holding off food for the night of the procedure and then trying again in the morning to see if they're still showing us signs of nausea. Second thing we'll talk about here, medications your pet may go home with. Most routine dental procedures aren't overly painful for them. They do get some pain medications before and after the procedure, making sure they stay comfortable. But as long as your pet did not have any excessive extractions or any excessive gingivitis, they may not go home with any medications. Main things that we will go home with here today is a packet of dental wipes to help encourage at-home dental care following the procedure to hopefully prolong the period they need in between anesthetic dental cleanings. The last thing we'll talk about here is at-home care for extractions. So if your pet did have a surgical extraction of a tooth here today, they will go home with a couple medications. The first and most important one being an anti-inflammatory medication such as either meloxicam or carprofen, which is going to decrease the inflammation in the mouth, make that extraction site more comfortable while it heals for us. Your pet will have suture in its mouth if it did have an extraction. That suture will dissolve by itself over the next 2 to 3 weeks, so there's no need for a suture removal after that period of time. If they had extractions, they will also need to eat a soft or a canned food diet for the next 2 weeks as well, making sure that there's nothing irritating the gum line where that incision is. Ideas for what you can do for either a canned or wet food diet would be getting a canned version of the same food that your pet already eats, or even using their dry kibble, soaking it in water for 10 to 15 minutes prior to giving it to your pet, and then giving it to them so it has softened up at that point, not causing any trauma to the incision line where that incision was performed. Other things that we'll want to keep in mind is avoiding excessive tug-of-war, chew toys, or any kind of playtime that involves the mouth for the next 2 weeks to make sure that incision line is not messed with at all. Main things that you'll want to monitor it for if your pet had an extraction would be excessive bloody discharge. It's normal for them to have a little bit of blood-stained saliva for the first 24 hours to 48 hours after the procedure, but if it continues to persist, or if they're showing signs of pain associated with their mouth, like not wanting to eat, not wanting to drink, open the mouth as much, or potentially even licking the area where that extraction was performed, please let us know. We'd be happy to take a look at everything, making sure, one, the incision is still looking good for us, and two, your pet is not in pain as well. That is my general overview for extractions and at-home care for your pet. So please don't hesitate to reach out if you have any questions or concerns. Our phone number is 704-703-1414. And you can also reach me at my email, which is drschuljak@queencityah.com. Have a good day.